staying right on time. We have a lot of people that would like to testify, and we are going to go up very quickly. You will have up 3 minutes. You will be timed to come up to speak. Please come up to the microphone. We'll make sure the microphone is turned on. Also, our decorum as far as committee rules are, please no cheering, please no applause. Let's all have proper decorum, please, in this committee room. The other thing is that when you do hear the timer, please don't make me have to cut you off. Please finish at that time. Also, if you don't need the full 3 minutes, please don't take the full 3 minutes, and that will give us time to be able to have more questions from the committee, and they would love to ask you questions, and sometimes questions are more valuable than testimony. So we're going to begin with proponents, and Senator Mike Thompson has agreed, if you would, to allow your time to some others.
Yes, Madam Chair, I'll let my written testimony stand and yield my time to much more compelling testimony from people who've lived this situation. Thank you, Madam Chair.
And now we will have a bill brief from our reviser.
Good morning. Thank you, Madam Chair, members of the committee. Senate Bill 233 creates a civil cause of action, and it would be allowed against a physician who performs a childhood gender reassignment service, and it would require revocation of that physician's license if they perform such service. Section 1 creates a new section of law, and this would allow an individual who had a childhood gender reassignment service performed on such individual as a child, and it would allow a cause of action against the physician who performed that service. This action would be allowed to be brought up to 3 years after the individual reaches the age of 18. And in subsection B, childhood gender reassignment service is defined as any acts performed on a child under 18 years of age with the purpose of attempting to affirm the child's perceived gender. And this would include sterilization procedures or procedures with the intent of sterilization, certain surgeries, and prescribing various hormones and hormone blockers. Subsection C of the bill would provide exceptions for children who have medically verifiable disorders of sex development, which are described in the bill. And this bill would allow an individual to seek actual and punitive damages, as well as injunctive relief, and would allow a prevailing plaintiff to recover costs as well as attorney fees. And Section 2 amends KSA 65-2836, and this is the section of law that provides grounds for various forms of discipline, including revocation, suspension, or limitation of healing arts licensees, and this bill would create a new subsection B. It's on the final page of the bill, and it would apply just to physicians, and it would require a physician's license to be revoked upon a finding, and this would be a finding by the Board of Healing Arts, that the physician has performed a childhood gender reassignment service. And with that, I'll be happy to answer any of the committee's questions.
Thank you, Jenna. I know we're really short on time today, but some people, of course, initially turned in their testimony for SB 12. This is now SB 233. Could you explain the difference?
Yes, there'd be two differences. The first is that the Senate Bill 12 created a crime with a fairly harsh penalty, severity level 3, if I remember correctly, which is equivalent to manslaughter for performing a childhood gender reassignment service, and this would instead create a civil cause of action. And that bill, instead of providing for revocation of the physician's license, it amended KSA 65-2837, I believe, which is just for a grounds for professional misconduct. And so this would be a harsher penalty for licensure up for the physician who performs the service, but a lesser penalty, I guess, sort of. It's a different type of penalty for civil versus criminal penalties.
So a loss of license, and then opens them up to a civil lawsuit or civil penalty,
Yes.
rather than a criminal penalty. And then the age for
Oh, yes. The age was changed from 21 down to 18 in
down
this
to
bill.
18, so a minor.
Yes.
Okay. Thank you very much, Jenna. We're going to begin with testimony from Chloe Cole, a private citizen. Chloe, can you come forward? Welcome to committee.
Hello. I'm Chloe Cole, and I'm an 18-year-old detransitioner who was harmed by these treatments as a minor. I started socially transitioning at 12 before getting diagnosed with gender dysphoria at 13 and starting puberty blockers and testosterone in my 8th grade year. And the summer after my sophomore year, when I was only 15, I underwent a double mastectomy, and my breasts were permanently removed. I had several comorbidities that were ignored or dismissed as just part of my gender dysphoria. I started puberty early. I was only about 8 or 9, and I had to deal with the stress of my body developing quicker than my mind, and my peers and the adults around me making uncomfortable comments on it. I started developing body image issues very quickly because of this, and I was also afraid to go from a girl into a woman and experience things like periods and childbirth and menopause, because I would often only hear about the scary things that being a woman had to offer from other women. And I didn't really have any female role models. I wasn't all that close to my older sisters or my mom, but I did take after my older brothers and dad, and I grew into a tomboy. I also had some autistic tendencies from a young age, but I wasn't diagnosed until I was much older. Today, I'm still experiencing some serious complications from all 3 of the main interventions. I had my puberty blocked when I was already about 4 years in, and I was post-menarche. So the drop in hormones forced me to have a period, and then soon after that came some menopause-like symptoms, including severe hot flashes and itching. This went away after my final shot of blockers, but to this day, I still experience joint pains and shooting pains up my back. I was told by my endocrinologist during the appointment for my testosterone that I would experience vaginal atrophy, but I wasn't informed that this atrophy also affects other organs in the pelvic region. And though I was prescribed topical estrogen, it still affected my urinary tract, and I'm still prone to getting infections or being dehydrated or having to use the bathroom rather frequently. And I wasn't informed of any of these, but I don't know if, because I started so young, I don't know if I'll be able to birth children, but I know for sure that I will never have the choice to breastfeed any of my children as an adult because my breasts are gone. And I was informed of this by my surgeon, but because I was so young, I was only 15 years old. I wasn't thinking about having a kid. I had no idea what that might look like for me. I didn't understand the importance of breastfeeding or being a parent because I was still a minor. And on top of that, the areolar skin grafts they used in my surgery have started to fail about 2 years afterward, and I have to wear bandages on my chest every day. The doctors who got me into this situation in the first place have not given me the appropriate care for any of these complications either.
Chloe, I'm so sorry. I have to stop you there. It's been 3 minutes. I know it doesn't seem like it, but there will be opportunity for questions. Thank you so much
Thank
for the
you.
story. And next we have Presha Mosley. Presha, could you come forward?
My name is Presha. I was 15 years old when I learned about gender ideology from the trans community. At 17, I was being medicalized with a high dose of testosterone. 1 year later, my healthy breasts were cut off. I had pre-existing diagnoses of anorexia nervosa, anxiety, panic disorder, major depression, and borderline personality disorder. I also experienced a sexual assault at 14. This started me on the path to multiple suicide attempts and years of self-mutilation with which my doctors assisted me. I realize now that this is what my transition care was, self-mutilation, no different than the cutting. My doctors removed my healthy breasts, deeming me healthy enough to consent to that, but not to liposuction. Taking cross-sex hormones and removing my breasts did not relieve me of my suicidal ideation. In fact, it made things worse. I needed trauma therapy, but when I uttered the word gender, I was fast-tracked to transition. Now I have 2 huge scars across my numb chest where I only occasionally feel zapping pain. My neck and shoulders broadened beyond my frame, and they constantly burn from the overgrowth. I have suffered hair loss on my head and hair growth on my body, which I have to treat with laser hair removal. Insurance isn't helping. Doctors have abandoned me. I am left alone with a ruined endocrine system, sexual dysfunction, and chronic pain. I want to save children from experiencing this pain as they chase a temporary euphoria promised by doctors selling snake oil. If you medically transition, you will be on the medical leash for life. I fully support a bill that protects youth from so-called gender-affirming care.
Thank you very much.
Thank you.
And next we have Dr. Roy Epen. Dr. Roy, are you on the WebEx? Not yet. Could you check to see if Dr. Arthur Shaper is on
Hello?
WebEx?
Can you hear me?
And you are?
This is Arthur Shopper.
Oh, okay, good. Thank you so much. Please proceed. We will give you 3 minutes, and if you don't hear the bell, I will interrupt you. Thank you
Thank
so
you very
much for
much.
being with us today.
Excellent. My name is Arthur Shopper, and I am the Field Director for Mass Resistance. We are the international pro-family group that makes the difference. Our Kansas chapter is particularly alarmed by the growing craze across the United States and the world to allow destructive, harmful procedures on children to change their sex because the child is suffering from gender dysphoria. The facts are evident from a growing body of research that although children may experiment with pretending to be the sex they were not born to be, they end up growing out of that phase of life and become comfortable with their natal sex. Parents, adults, and agencies have a duty to reflect reality to everyone, especially children. Just because a child feels a certain way does not mean that authority figures should capitulate to children's fantasies. In 94% of gender dysphoria cases, children enter puberty and adulthood with no problems. It is essential that the Kansas State Public Health Committee understand that there are greedy interests behind this push to transition children. Big business, including a large aspect of the medical industry, including in Kansas, wants to see these procedures continue. It's all about the money and not the well-being of children. Now, we need to counter potential arguments on this. Some will say this is about parental rights and the state should stay out of the relationship between doctors and families. That is wrong. This matter of child mutilation surgeries goes far beyond parental rights. Parents do not have a right to molest, beat, starve, or abandon their children. Imposing transgender procedures on children is nothing short of child abuse. The state has a right and a necessity to intervene to prevent these procedures. And by the way, liberal interests like Planned Parenthood are now staunch supporters of this government intervention between parents and children when it comes to this matter. They oppose the state getting involved when it comes to abortion, but they have no problem when it comes to mutilation of children. Kids who want to transition can change their minds, some will argue, and they suffer no consequences. You have certainly heard that that is not the case. Some will argue that this bill is transphobic bigotry and nothing more. But the fact is that true transphobia occurs when responsible parties refuse to take a stance against the lies of the LGBT agenda and its political allies. When people are too afraid to speak the truth that there are two sexes and you cannot change your sex, that is true transphobia. Last of all, you will hear that a number of professional organizations have declared that this so-called gender-affirming care prevents suicide, saves lives, and does not have lingering effects. If the doctors say it's okay, then we should all disagree, then we should all agree, right? But the truth is that many of those professional organizations have been ideologically captured and politicized. They are pushing an agenda, not truth. They are pushing fantasies for financial gain, not facts to protect the family. It is love, not hate, to speak the truth. It is time to stop these evil procedures. And last of all, I encourage every one of you to Google on YouTube, "Youth Transgender Regret," and you will see countless testimonies of children, now grown up, who regret going through these horrific gender transition procedures.
Mr. Shaper, thank you so much for your testimony. Our 3 minutes is up. Thank you very much.
Thank you.
Next, we will go to John McDermott, pastor.
Good morning and happy St. Valentine's Day. I stand before you as someone that's been involved with youth for over 30 years. and have learned a valuable lesson that oftentimes as we walk along the youth, we can make an incredible difference in their life and prevent them from making life-altering decisions that will affect them for the rest of their life. You know, as I just heard some of the testimony and Chloe's testimony, I feel that it's so important for us just to pause for a moment and just think about what she just communicated and the others. But you know, when we think about it, we already have laws in Kansas based on the science that we know that children's minds aren't developed enough to make decisions. We have drinking age at 21. You can't buy tobacco products until you're 18 or 21. And so we know the science says that minors don't have the capacity to make these lifelong decisions. So thankfully, we follow the science. You know, I really think about this, and I think about how it comes down to the understanding that, you know, it really is an exploitation of the vulnerabilities of the youth. You know, I strongly urge you, as I sent all of you the testimony of Jamie Reed's. You know, although she thought she had been helping to save trans kids' lives, she could not deny the truth of the exploitation of children she saw as a case manager at the Washington University Transgender Center at the St. Louis Children's Hospital. And even though her ideology is not probably common to what most people have in being in favor of this legislation, she made the heroic decision as she saw the facts before her, and she decided to become a whistleblower. And her article is entitled, "I Thought I Was Saving Trans Kids, Now I'm Blowing the Whistle." And so, you know, I just think there's an incredible amount of information out there for us. You know, the science about what's happening, what's actually done in these transition surgeries and these chemical castrations. The science is there right in front of our eyes. And I'm reminded of what the Supreme Allied Commander Dwight D. Eisenhower did when he witnessed the brutality of the Ohrdruf concentration camp in April 1945. He did something that I think is incredibly brilliant. He compelled the Germans living in the surrounding towns to witness the atrocities for themselves. So he had them tour the concentration camp. And when many of the townspeople began to say, "Hey, we didn't know this was happening," Dwight Eisenhower responded very boldly, "You didn't want to know." And I think it's important for us to have the courage to look beyond the ideologies and the propagation cascading down upon us. Thank you very much, and I ask that you support this legislation.
Thank you so much. Dr. Galen Perry.
Thank you for allowing me to testify. You've seen me 3 times in less than a year, or about a year, and the main reason that I'm here is because I care about patients. These testimonies were extremely humbling, I think, for all of us. The other reason I can stand here is because I am now independent. I am not beholden to any employer. I can speak my mind without reprisal. And I have no conflict of interest. I am here on behalf of patients, which is what my passion is. I know an endocrinologist at the Children's Hospital downtown who is afraid to speak out because he's afraid he'll lose his job. I left my job so I could speak out, and that's why I'm here. I actually take care of individuals who struggle with gender dysphoria because they have a lot of mental health issues. They struggle with sleep, and I'm a sleep professional. And I have compassion for these individuals. I put in my written testimony that the European countries are closing these clinics. I'm not sure why we're doubling down on them. And I spent 2 hours on the website of WPATH, which stands for the World Professional Association for Transgender Health. Their clinical guidelines were updated just this year, and I will let that document speak for itself. These are all quotes from that document. Quote, "Despite the slowly growing body of evidence supporting the effectiveness of early medical intervention, the number of studies is low, and a systematic review regarding outcomes of treatment of adolescents is not possible." Quote, "A 2014 long-term study follow-up there was only one study that followed the use from early adolescent until adulthood. Quote, there is limited data on the optimal timing of gender-affirming interventions, as well as the long-term physical, psychological, and neurodevelopmental outcomes in youth. And the medical journal articles are also in this document. Quote, last quote, longitudinal studies are currently underway to better define outcomes as well as safety and efficacy of gender-affirming treatments in youth. So even in the document where they go for their clinical guidelines, they are saying, we don't have the data. So my question to my physician colleagues is, how in the world can you take a healthy body and subject it and make it sterile into mutilating procedures that is not health care? These physicians have conflicts of interest, and they work for healthcare systems that will not allow them to speak out. Patients are not commodities. Please protect our patients in Kansas.
Thank you very much. And Dr. Krebs, since we were not able to get Dr. Epen on the line, we have time for your testimony.
Good morning, Madam Chair, distinguished members. Likewise, I'm not beholden to anyone. I'm retired. I'm here because I'm trying to speak the truth of natural law, and the truth given to us by my Savior.
Dr. Krebs, could you push the microphone up a little bit? The light should be on, and then where we can hear you. Want to make sure the people.
Is that better?
Yes.
Okay, great, thank you. My name's Festus Krebs, MD, and I'm a proponent of SB 233. I wish to relate a history lesson concerning transgender philosophy, politics, and medicine. In 1980, I was a surgical intern in San Francisco, California. In the emergency room, I saw a number of patients in extreme emotional and psychological distress and who had mutilated or missing sex organs. An older surgeon explained to me that years ago, the very progressive state had passed legislation funding free sex change operations and hormonal therapies. Subsequent follow-up studies on these patients proved that after sex change surgery, intensive psychological therapy and/or hormonal manipulation therapy, they were overwhelmingly more unhappy and had more serious psychological pathology as a result. They were completely miserable and maladjusted in society, with skyrocketing suicide and self-harm episodes. For reinforcement of these conclusions, a 2021 30-year retrospective study from Sweden found that compared to normal controls, sex change patients had 3 times the mortality rate, 19 times the suicide rate, 3 times the rate of psychiatric inpatient care, and a higher risk for criminal convictions. Fortunately, these California transsexual programs were all shut down almost a half century ago, and many lives were saved. I later learned that even in California, on the outer fringe of progressive thought, neither the populace nor the legislature had ever considered performing sex-changing operations nor hormonal manipulations on minors. Please learn from our painful California experiences of the 70s and pass this bill so we don't have to repeat the sex change disasters. Thank you.
Thank you very much. Committee, normally at this time, I would take questions from the committee, from the proponents, but to allow time for the opponent testimony and make sure we get that in, I'm going to go ahead and start, and then we'll save questions at the end. We will begin with Dr. Diana Hubbard.
Good morning, Madam Chairman and members of the committee. Thank you for the opportunity to provide my testimony on behalf of the Kansas chapter of the American Academy of Pediatrics with over 450 physician members. I'm a practicing physician and neonatologist taking care of babies in the neonatal intensive care unit. There are 3 points that I would like to leave with you today, the reasons we oppose Senate Bill 233. The first is interference with the physician-patient relationship. It's interesting that I spoke to this committee just yesterday on a public health issue regarding infectious diseases, And I heard a lot of not co-parenting with the government and medical freedom. And that was for public health. That's something where your decision affects other people. This is an individual choice between a patient, there is parental involvement, and the physicians. So there is absolutely no place for politics or legislation in that doctor-patient relationship. Gender-affirming care is evidence-based, and it is, again, between a trained, skilled physician, patient, and the parents. Gender diversity is not contagious. Many of the hormonal therapies are reversible, giving these children time to explore their gender identity. So number one is interference with the physician-patient relationship. Number two, this legislation harms the mental health and psychological well-being of gender-diverse youth. Gender-diverse youth already have an increased risk for anxiety, depression, and suicide, not because of their gender diversity, but rather because of the discrimination that they face. With supports around them, there's actually not an increase in depression and anxiety. Studies show the psychosocial benefits of hormone therapies of that treatment being available. Again, this should be left to physicians and patients and parents. So my question is, in Kansas, do we care for the mental health of all children or just cisgender children? My third point is the potential to harm for other children. There are too many exceptions to the rule and interpretation for this to be in legislation. There are hormones and surgery that are required for other diagnoses. One that I occasionally see in the NICU is ambiguous genitalia. And I've had to tell parents, I cannot tell if this is a biological male or female based on their external genitalia. They need surgery. Congenital adrenal hyperplasia, which is on the newborn screening, those patients sometimes have ambiguous genitalia. Hypospadias, where the penis is not formed correctly, those babies need surgery. Later on, precocious puberty, menorrhagia, high bleeding with menses. These are things where these same medications may be needed. And so legislation like this, these bans will severely hinder medical treatment. Thank you.
Thank you. Next, we will have DC, I'm sorry, is it Hegert?
It's Hegert. You got it.
Hegert, thank you.
Yeah. Good afternoon. I appreciate the opportunity to present testimony here today on behalf of the ACLU of Kansas. My name is DC Hegert, and I'm a lawyer and the ACLU's LGBTQ+ legal fellow. We stand strongly opposed to SB 233 and urge you to not vote this bill out of committee. This bill violates the constitutional rights of Kansas children, their parents, and their doctors, and poses an unprecedented threat to Kansas families by effectively banning the only evidence-based healthcare options available for children experiencing gender dysphoria. This bill places politicians' feelings above the expert medical advice of hundreds of thousands of doctors and effectively bans young trans people's access to medically necessary, safe, and evidence-based care supported by every major medical association. Bills like this have been struck down by courts across the country for violating equal protection and due process rights. And while every state that has attempted to defend these bills in court has lost, those states did succeed in charging enormous legal fees to their taxpayers. Not only does this bill take away parents' rights to make decisions about their children's medical care, a right that some in this room have vehemently defended in other contexts, but it threatens Kansas doctors with losing their license and facing lawsuits for simply trying to do their jobs. This bill won't protect Kansas children. It will unequivocally harm trans youth and violate Kansans' constitutional rights. And I do not mean this in an abstract sense. People will die. Families will suffer. The practice of medicine will be compromised, not just for trans young people, but for everyone in Kansas. I'm sharing this testimony as a constitutional lawyer with the ACLU, but also as a lifelong Kansan and a trans person. The very care this bill attacks is the reason I am alive and confident enough to advocate for my fellow Kansans' rights. I love Kansas, and I'm proud to call it my home. I know countless other Kansans that feel the same way. But bills like this tell us that our state does not love us back. Please don't make it harder for these young Kansans to be themselves and feel welcome in this state. We urge you to vote no. Thank you.
Thank you. And next, we have Adam Kellogg.
Thank you, committee members. Good morning. My name is Adam Kellogg. I'm 19 years old. I'm a student at the University of Kansas studying psychology. In fact, I actually hope one day to be a therapist with KU. I have an amazing group of friends, a loving mother, and my best friend Kate calls me every day from back home in Olathe. But none of that is why I'm here today. Instead, I'm asked to talk about my other experiences as a transgender man. My necessary healthcare is again up for debate. And I really appreciate John McDermott's testimony. I really do feel like an atrocity. Thank you. I'm kidding. Over the last 7 years of living as a proud transgender man, the beauty and joy of being who I am has not wavered. I came out when I was 12 years old, and about a year after my debut to the world as Adam, I went on reversible hormone blockers. I got to participate in my own healthcare, and my team of support made decisions with me and my safety in mind. Such a process is routine for transgender kids who seek medical interventions, but would be destroyed by SB 233. After 4 years of blockers, my mom, my doctors, and I agreed that I would have the smoothest transition if I went on hormones before I left for college. So 3 days before my 17th birthday, I took my first shot of testosterone. Committee members, when I took the first shot, the weight of the world lifted off my shoulders. Removing my breast just after I turned 18 was even better. I bet my spine straightened like 30 degrees. I was just so confident. A flat chest meant that I didn't have to hunch my shoulders and shove my hands in my pockets anymore. My doctors, my mom, and perhaps most importantly, I were right. College was much easier to handle after I had my medical interventions that I needed to be my true self. For once, I lived my life with a purpose rather than as an obligation. What I want to help the committee understand is that medical transition is not just about saving lives, but it's about emboldening and freeing them. I can't imagine such a life without medical interventions, and I don't want this committee to imagine it either. Young people like me deserve access to treatments that they, their doctors, their therapists, and their families deem appropriate for their lives and their journeys. I urge you to strike down SB 233 and continue to allow transgender youth to experience the beauty of starting their lives in the bodies that they love, just like I have been so blessed to. Thank you.
Thank you. And next, we have Amanda McGhee. I hope I said that right.
Thank you for allowing me to speak today. My name is Amanda McGhee. I'm a primary care and hormone therapy provider in Wichita, Kansas. I am AANP board certified in family practice and WPATH trained. I currently provide gender-affirming care to individuals who will be harmed by this bill. Today, I ask you to stop this egregious attack on the transgender community and the providers who care for them under the disguise of protecting minors. It is my professional opinion that SB 233 will negatively impact the lives of transgender youth, directly resulting in an increase in suicide-related deaths of your constituents. Their blood will be on your hands. SB 233 seeks to make it harder for healthcare professionals to provide gender-affirming care by threatening us with lawsuits and revoking our licenses. This is unethical. Price noted that when we disregard a patient's dignity and autonomy over their own body, we lose trust and we break the provider-patient relationship, which is critical to effective medical care. As a competent healthcare provider, I joined the World Professional Association for Transgender Health, the certifying board for my specialty. I practice explicitly within their guidelines for the medical treatment of gender incongruence and within the limitations of my licensure and my certification. I've obtained over 300 hours of trans healthcare specific CEUs, and I have over 4 years of experience providing care for trans folks. This is the same way that any other competent medical provider practices, by joining the certifying body for their field, gaining education and experience, and consulting with experts as needed. WPATH produces a scientific standards of care document outlining the responsibilities of and requirements for medical professionals when providing gender-affirming health care. The recently recently released SOC 8 is 260 pages long. Yes, these guidelines are well-defined and extensive. For a minor to access gender-affirming care, I independently and in collaboration with mental health experts ensure that patients can endorse persistent and insistent gender dysphoria, understand the risks versus benefits of gender-affirming care, and the reversible and permanent effects of hormone therapies. I require all legal guardians to be involved in these discussions, and legal, informed consent must be given in writing from minors and their guardians. It is my ethical responsibility to provide high-quality, competent, well-regulated care to my patients, and I assure you, I don't take this lightly. Multiple studies have shown that affirming chosen gender is consistently linked to lower rates of suicide attempt, and all the major medical associations agree. Leave healthcare to the professionals. We are doing what is right to protect the minors in our care, and Kansas should not be wasting taxpayer dollars on political posturing that serves no purpose, as the legality for patients to sue their healthcare providers is already there. This is why we are legally required to carry malpractice insurance. Medical treatment is a crucial and very personal service that virtually everyone depends on at some point in their life.
Thank you. Thank you
Let
very
us do it.
much.
Thank you.
Next, we have Reverend Kayla Simmons Woods. Did I say that right? Yes. Good.
Madam Chair and members of the committee, thank you for the opportunity to speak in opposition to this bill today. I am the Reverend Kayla Simmons Wood. I speak to you today as a fifth-generation Kansan, as a mother, as an ordained pastor. I am president of the Kansas-Oklahoma Conference of the United Church of Christ, and I speak today on behalf of Kansas Interfaith Action, a statewide multi-faith issue advocacy organization. I also refer you to the testimony submitted by 10 other clergy from around the state opposing this bill. My faith compels me to work to create a world where all of God's beloved children are treated with dignity and respect. I and many other Christians believe that transgender people are created in God's image and have sacred and inherent dignity and worth. In my faith tradition, the protection and support of children is especially sacred duty for adults. Our teacher, Jesus, ardently defended and loved children and tells us to do the same. It is for these faith-based reasons that I urge you to oppose this bill, which prevents parents from protecting and caring for the health of their minor children. We know that transgender youth are at a significantly increased risk for suicide. We also know that gender-affirming healthcare, which is supported by all major medical associations, is the only evidence-based treatment available for transgender youth. The legislature has no business taking away the rights of medical professionals to do what they are trained to do. Furthermore, it is imperative that the government not infringe upon the rights of parents to make healthy decisions with and for their minor children. This is a gross overreach of authority. Our bodies are a holy gift from God. My religious beliefs affirm that God is present within each person and that bodies have sacred worth. We have a sacred duty to care for our bodies, and the legislature has no business taking that right away. Children are a gift from God. As a mother, I recognize that I have a sacred duty to care for my own children and do everything within my power to protect them. All parents want what is best for their children, and that includes ensuring that they have access to necessary medical care. Gender-affirming care is medically necessary, it is safe, it is effective, and it literally saves lives. In my work as a pastor and as a regular volunteer with an organization that serves LGBTQ youth, I have met the youth that this bill would affect, and I interact with them on a regular basis. They are unique and precious like all of their peers, and they deserve the right to be able to access healthcare just like we all do. Thank you for your time.
Thank you. And finally, we have Beth Aller.
Thank you for the opportunity to speak to you today, albeit virtually. I am providing virtual testimony today because of my profession. I am a board-certified family physician, an actual practicing Kansas physician, as is my husband, and we've practiced in our rural, underserved community for the past 12 years. I provide full-spectrum care from delivering babies to end-of-life care, and I provide gender-affirming medical care. I am also the mother of 4 children, ages 10 and under. Due to my short time to speak today, I'd ask you to please review my written testimony. I didn't always provide gender-affirming medical care and thought, how many non-binary or transgender adults, much less adolescents, could possibly be in my practice or my rural part of the state? And the answer is many. I don't have time to even skim the surface of the stories of those I'm privileged to care for, but I can tell you that the need is great and the providers are few. And I can assure you that this care saves lives. You've been provided with statistics regarding the greatly increased risk of depression and suicidality of LGBTQ teens in Kansas, especially trans teens. What do you think legislation like this says to them? It validates their fears that not only are they not accepted, but they are not even worth basic medical care. If you are going to listen to medical opinions on this, listen to those from providers in your own state who serve your own constituents. If you are going to listen to stories from transgender adolescents, listen to the stories of your actual constituents and their families. Legislation like this will harm not only patients, but also our state. New physicians do not want to move to and practice in states where they are going to be threatened with loss of licensure or the ability to practice within their full scope. Questions regarding scope of practice and restrictive laws are now common in online communities. Everyone's story is important and they have the right to tell it. However, the voices that you as Kansas legislators need to be listening to are those of your constituents. Any of us who do this work can tell you that while there are rare stories that are heartbreaking, such as those of Miss Cole, these are in no way the norm. It's typically the result of environmental factors rather than regret, and the majority of persons who choose to detransition do so not because their gender identity has changed, but because either they can't afford medical treatment or they live in fear being themselves due to societal pressures and fears of violence. We need to listen to both sides, not only to those which have been carefully curated and chosen for presentation to fit an agenda. There are relationships that are respected in society, and one of these is physician-patient. The exam room is a sacred space to those of us in this profession, and decisions made in it should be made between the people in the room. We take an oath as physicians to do no harm, and I would suggest that we all try to live by that same credo. Making blanket rules does harm. We can't legislate for every possible scenario, which is why we have to trust the professionals doing the work. I don't know everything and I don't claim to, but I do know that the person who best knows my patient is my patient, and I know that I believe them, I trust them, and I'm there to work towards their health goals regardless of label. I'm asking you to do the same, to believe that your constituents, their loved ones, and their medical providers know themselves best, and that they should be able to make decisions regarding their health without government infringement, and to trust those of us who've dedicated our lives to caring for the health of Kansas. We deserve to do so without the threat to our livelihoods, our
Dr.
medical
Aller,
licenses, or our
I'm so
reputation.
sorry. Can you hear me? Our time is up. Thank you so
Thank you.
much for your testimony. Committee, you can see the clock. It is 15 minutes after. Typically, I would close at 5 minutes from now. We're supposed to vacate the room at 20 after. We're going to try to go with 10 minutes. That will allow very little time for each of our members to ask a question and then for you to answer. So the member will call you up, ask a question. Please answer very briefly so we can get as many of their questions in as possible. And we'll begin with Dr. Steffen.
Thank you very much. This is ultimately will be for Dr. Hubbard. The important thing here for everybody to understand is we started during the opponents hearing the term gender-affirming care. And that is defined by the president of the American Academy of Pediatrics, which Dr. Hubbard is a member of and quoted. But the president of the American Academy of Pediatrics defines gender-affirming care as it means destigmatizing gender variance and promoting a child's self-worth. Gender-affirming care can be life-saving. It doesn't push medical treatments or surgery. For the vast majority of children, it recommends the opposite. So, Ms. Hubbard, are you here to tell me today that the American Academy of Pediatrics unwaveringly supports surgical intervention as part of gender-affirming care?
First, I'd ask you to address me as Dr. Hubbard, please. And I would say that there are lots in semantics with gender-affirming care. We support the health and well-being of children. We are not saying that every child that has gender diverse, that they need surgery. In fact, they really promote other things, including psychosocial support and treatments that are reversible.
Again, to make it very clear that the president of the American Academy of Pediatrics specifically state that it doesn't push medical or surgery in this situation.
Senator Holscher.
Great, thank you. I'm going speed round here. Chloe, Presha, I have a question for you, and then Dr. Krebs.
Which one? Chloe and Prisha are two different people.
Oh, both.
Both, okay. Could you both come up to the microphone?
Thank you so much for being here. I appreciate your testimony and listened very intently, so thank you for the information. Can you tell me where in Kansas you've received your transitioning or gender affirming care?
I'm not from Kansas, I'm from California.
Oh, okay.
This happened in North Carolina.
Oh, okay. Okay. Okay, well, I guess, is this the first time you all have testified?
Oh, no, I've done this
No.
plenty of times before.
Oh, okay, very good, thank you. And then I did have a question kind of relative to that for Dr. Krebs. Thank you.
Thank you.
Good morning.
Yes.
So California was mentioned, in your testimony, California was mentioned from the 1980s. It strikes me that those are issues from several decades ago and not here and not current. Can I ask you, where do you practice?
I'm not practicing now. I was talking about back in the 70s and 80s, the history.
Okay, so you are not practicing?
No, I'm not practicing as a
Senator
physician
Holscher, I'm
now.
so sorry. We have to move on.
Okay, and can
Thank
you
you,
verify you
Dr.
haven't had
Krebs.
a license in Kansas since 1990?
And now we'll go to Senator O'Shea.
Thank you, Madam Chair. My question is for Dr. Beth Aller on WebEx. Can you share with me where you work?
Yes, I work at Rooks County Health Clinic. I live in Stockton, Kansas, and care for the people in Rooks County.
Thank you. Senator Petty, did you have a question? Okay.
So my question is for Adam Kellogg. Adam, thank you for being here today. You mentioned that I wanted you to just share again with who is it who supported you in your decision?
Yes, my wonderful mother, Debbie Kellogg, was a major support, as well as the staff at KU Med and Children's Mercy Gender Affirming Clinic.
So when you went to KU Med and Children's Mercy, did the doctors present you with all sides of your decision?
Indeed, they actually did warn me of all the side effects, and I took them in stride happily, including different lifespan changes, and as well as the beard, the acne, which has been a major problem, and everything in between. And I happily took that all, despite knowing the risk.
Thank you. Senator Thompson?
Thank you, Madam Chair. This is actually for Presha. Presha, thank you. Two questions. Number one, you said in your testimony you were 15 when you learned about gender ideology from the trans community. Do you believe you were groomed into making that decision?
I don't like the word groomed because I think it creates too much of a divide, but I was coached on what to tell my doctors to get prescriptions to feel better by the trans community.
And do you believe that the procedures used on you were safe?
Absolutely not. My life is destroyed.
Okay, thank you, Presha.
Senator Baumgardner?
Thank you, Madam Chair. My question is for DC Hegert. Thank you for sharing today. DC, you talked to us about your representation with the ACLU, but you spoke of hundreds of thousands of doctors. And I was looking in your testimony, I didn't see that. So hundreds of thousands is quite a quantity. Are we talking worldwide? Are we talking, obviously not Kansas?
So I believe this is in my testimony, but if not, I can provide you with the citation. I was referring to the hundreds of thousands of doctors represented by all of the major medical associations that support this care. That totals 1.3 million doctors. I believe that citation's in my written testimony. I'd refer you to that, but if not, I'm happy to provide that with you after the committee.
Okay, I would like to receive that. And Madam Chair, if we could please get some information through legislative research as far as the number of surgeries that are being performed in Kansas, and are they particular health systems? Is it occurring at Via Christi? Is it occurring with the different systems that are now owned by KU Medical Center? So if we could get some more information on that. And also, with regard to Dr. Hubbard, she made reference of evidence-based, and those are terms, but give us that actual evidence, because some of what we're seeing as evidence-based is the drugs that are utilized are causing early onset cancer. So if that could be provided to the committee later.
Thank you very much, and yes, that is a committee request. Jace Blasey, Senator Blasey.
Okay.
Thank you, Madam Chair. This question's for Dr. Hubbard, and it's really a simple question. I think, is your position on behalf of the entire Kansas chapter of Academy of Kansas Pediatrics?
I am here as the public policy chair for the Kansas chapter.
So has the Kansas chapter taken a vote on this? I'm just curious if the general membership supports the position you've stated.
Yes, the general, in terms of our executive committee and the majority of our members, as well as the 67,000 members of the AAP, which may be part of the hundreds of thousands. Of course, not every single person, but the far majority.
How many members are part of your chapter?
Over 450.
Thank you.
Thank you, Dr. Hubbard. If you could remain at the microphone, I have a question. I'm sure we've all read the whistleblower that was mentioned earlier on the Missouri side, and rather compelling testimony from a woman who considers herself at the far left and came to support transgender children services, and very interesting testimony. Have you read that, and what are your thoughts on that?
I have read that. I'm very concerned because two of those physicians that are being targeted by the Attorney General's office for their license, one of them I trained with. And so I'm very concerned. I don't think we have an abundance of physicians, especially an abundance of pediatricians who are paid. They're the lowest paid specialty of all specialties, as I'm sure people know, because Medicaid reimbursement doesn't have parity with Medicare. So I would just say that pediatricians want to care for kids. They want to care for all kids, regardless of their gender identity.
This was particularly a transgender clinic, correct? Okay.
That I don't know all the specifics, but.
That's what I read. Thank you very much. Yes, Senator Erickson.
Thank you, Madam Chair, and this is for Dr. Hubbard or whomever would want to answer from the medical community. So as a former educator, we did a lot of study and professional development on the brain development of children, so we knew best how to educate them. So my question is, are there other areas of medical practice where the child directs their health care? Diabetes, cancer, any other treatment where the child directs their health care?
I would say everything the child is involved. I would not say that the child themselves direct healthcare for gender diverse issues. There is parental involvement. That's what we support. It's not just a child, but we actually encourage children, especially adolescents with chronic health disease, to really take charge of their health care so they'll be prepared for adulthood.
Do you believe that children have the brain development and intellectual ability to make lifelong medical decisions?
I'm not sure any of us have that true ability to make the right decision every time. I would say that, again, many of these, it's not that they go straight to surgery. It's not that they go straight to hormone blockers, but some of those hormones are reversible, so that allows them time to mature. I will also recognize that, yes, while the legal age for alcohol and tobacco is 21, some guns can be purchased at 18. So I think if we are going to apply that issue, we've got to look at all areas.
I'd like to take a moment
Thank
if
you,
I
Madam
could
Chair.
answer that as well, if I could.
I'm sorry. We're totally out of time. Thank you so much. And committee, we are adjourned.